Anderson,
Present.
Commissioner Khalil,
Here.
Chair Scott.
Present.
You have a quorum present.
Thank you. Next item, please.
B, Chairwoman's remarks.
I have none at this time. Next item, please.
C, approve the July 9th, 2024 meeting minutes.
Motion to approve the minutes. Moved by Commissioner Marecki, supported by Commissioner Anderson. All in favor?
Aye.
Any opposed? Hearing none, motion carries.
It's up there now.
Thank you. Next, Madam Clerk.
D, unfinished business. There is none listed.
Okay, next item, please.
Item 1, under new business, forwarding the medical examiner's report on the turnaround time analysis for April 2024 to June 2024.
Okay.
How are you guys?
Wonderful.
That's
Thank
good.
you for being here.
Charlie Rose, the Division Director for the Medical Examiner's Office. So with this quarterly report, we're reporting from April 1st to June 30th of 2024. During this 91-day period, 3,895 decedents were reported to our office. We accepted jurisdiction of 673 of those. 424 had a full autopsy. 221 had inspections only, and 28 of them had limited autopsies. For the histology turnaround, we had 283 cases that were submitted. 120 cases had tissue blocks and slides with a turnaround time average of 5 days. The final cause of death and amendments, 673 cases that were brought in from April until June. Within those 91-day period, 400 of those cases were completed in the average of 13.6 days. Within this time, they also had the final cause of death of 192 of those cases within a 30-day period. And last but not least, during this 91-day period, we had 2,948 cremation requests, and we've gotten that down substantially where that's completed within the 8-hour work period.
All right, thank you
Yes.
for that wonderful report.
Yeah, you're welcome.
I can't see whose name that is.
That's me.
Tim Khalil, please, Commissioner Khalil.
Thank you, Madam
Mhm.
Chair. On the final cause of death, what does TAT mean?
Turnaround time.
Okay, that
Mhm.
helps. I was just guessing, but. And then on the cremations.
Mhm.
Which we had been hearing about quite a bit before we had the new. Now I see 40% of them
Mhm.
are outstanding invoices.
Yeah, so probably during that period of time, but they've been paying them quite quickly.
I was gonna say to have
Yeah.
1,200 outstanding, average days 25.
Yeah.
Is there any, I mean, after we heard all about it, now it's like, well, we'll get around to paying the bill. Any concerns that you have?
Not
about
at this
that?
time, no.
No?
Mm-mm.
Okay. All right, thank you, Madam
All
Chair.
right, thank you, Commissioner Khalil. Commissioner Monique Baker McCormick.
Thank you, Madam Chair. So we had talked about maybe a list of other reports, well, in particular, deaths in custody
Mhm.
at one time. So that's not in this.
Yeah, so
report.
remember, I think we agreed on it being annually.
Oh, was it annual?
Yep.
Oh, okay, then that's why.
Okay, I'm sorry.
Yeah, no problem. And does that include, that report includes suicides?
Yep, it would include the
but-
suicides and homicides as well.
But veteran suicides?
No, I can add that though.
Yeah,
That's something we
I
can
think
add,
that'll
okay.
be interesting to
Okay.
know how many veterans. And then it also indicates opioids,
Mhm.
but by race at all or by
Yes, it will.
area?
Yep.
Okay, it will. Okay. Thank you. That's it.
All right, thank you.
Thank you all.
Anyone else? No. Thank you for the report, please. Next item, please. Okay, we're gonna leave the discussion at the end, so.
Moving to the addenda, item 3, requesting commission approval of a grant agreement with the W.K. Kellogg Foundation for the Well Wayne Initiative Learning Parents Partnership Project.
Good afternoon, Dr. Abdul El-Sayed, Director, Health Officer, Department of Health, Human and Veteran
Good
Services.
afternoon, Dr. Syed.
So we are requesting approval of a grant from the W.K. Kellogg Foundation to support a program that is currently in the works. It's a program that we first discussed in our budget conversation for fiscal year 24. What this would be is a program to support parents enrolled in community college who are struggling with the joint responsibilities of being a student, being a parent, and supporting their family. And what this would do would be offer $500 a month against cost of living. It would be all takers, but considering the demographic that our community colleges tend to serve, these will disproportionately be low-income residents as well as residents of color across our county. And this program would offer support, this grant would offer support not against direct program dollars, but rather against the cost of administering the program. So that means marketing and making sure we're reaching out to eligible families, assessment and analysis of our outcomes to understand what the impact of this program was, and other necessary support as needed. We think that this is a really important opportunity considering the fact that so far, the innovative programs that we've been putting together have largely been funded by post-ARPA funds, as well as braiding with some indigent funds, as well as opioid settlement dollars. This offers us a gateway to what we hope will be larger opportunities for funding. And we feel that turning HHVS and therefore the county into the fundee of choice and the recipient of choice, considering the innovation and competent execution of our programs, we feel like can help toward the sustainability long-term of the programs that we're offering. In terms of the current program, it's currently in RFP. RFP's out on the street, should be due up by August 8th for a program vendor. And so we hope to be able to bring that to commission as soon as that's ready.
Very good. Any questions? Commissioner Marecki?
Thank you, Madam Chair.
Mhm.
So this 250,000 is going, this is, the $500 a month is in this money, right?
No,
This is only to,
to support the overhead of the program.
okay, so it sounds like you're looking for other grants too, but
No, this would be funded through post-ARPA. The program itself would be funded through post-ARPA dollars.
it would be.
And initially, we'd be looking at a pilot, right? And we know that we can't kick this off ad infinitum considering the funding we have. But what we do want to do is pilot this. And if the outcomes are good, i.e. we find that parents are more likely to stay in and graduate from their community college programs, they're more likely to invest in their child's well-being, then what we hope we'll be able to do is go out and attract funding for a program like this. But for right now, the program itself would be funded on post-ARPA dollars, and this grant would help support program overhead so we can spend more of our funding actually administering the program.
Okay, so how much money are you going to be asking the commissioners to devote to this program?
So I think the current estimate we have is about 2.1. We don't have a vendor yet. So
2.1
million. Yeah, we don't have a vendor yet. And when we do have a vendor, we'll have a much better sense of what the program costs will be.
Okay. And is the vendor going to vet what goes on with this? Like if someone's still getting money, if they're not in school, they're going to be taking care of all?
Yeah, we understand the potential risks in a program like this. And we're quite serious about making sure that the support goes to folks who are enrolled in meeting program criteria. And that'll be part of what our program vendor will be responsible for.
So do you know of other types of grants that could sustain this after we put in 2.1 million?
So the hope is that this relationship that we're building with this funder and other funders, yes, opens up opportunities for longer term funding in the future. And Kellogg is really excited about this program. And, we think that the way this works usually is once you build a strong relationship with a funder, you have the opportunity to go back and ask for bigger sums of money for bigger programs. And so this is sort of, we'll just say a first date with Kellogg. And we feel like this has the opportunity to continue to blossom.
Do you know if Kellogg is offering this program to any other counties around here?
No, they're not.
They're not, just Wayne County? All right, thank you, Madam Chair.
Thank you, Commissioner Marecki. Commissioner Tim Killeen, please.
Thank you, Madam Chair. Good morning
Good morning,
or afternoon.
afternoon.
It's morning somewhere.
It is.
Yeah.
5 o'clock somewhere too.
Oh, that's it. We're done with questions.
I'll go with you. Can we get a copy of the Well Wayne 2025 plan?
Sure. We sent it through before and we can send it again.
Because I saw I looked at it, said, I don't know what this is, Well Wayne. And there was a comment that was presented, I guess, during the budget last year. And
So
then
that-
our staff asked the same question. Hey, so can we get an updated copy of that? please?
Absolutely. So the Well Wayne 25 is not a formal plan. It is more an overall umbrella name that we offer to a series of innovative projects that we've been working on.
And that will give the commission an idea what you are working on. For
Absolutely.
the future. This is administrative dollars we're looking at here.
Yes, sir.
Okay. So that's this money it's all going to be spent in-house getting this ready.
Yes, sir.
We get funding, is the funding
Well-
hopefully that we get after this to actually do the program? Is that going to be for, well, doesn't everybody get to go to community college, as a freebie now so well, I'll ask more when we get there, but what's the idea? We're going to help these families with what are they going to be able to spend these dollars on?
Support the vendor, but it will be funding spent against the cost of executing on the program.
The eventual
Right.
vendor.
And this is $500 unconditional cash. So
Okay.
they can spend it on whatever they need to spend it on. And the idea here is this. I mean, I think about my experience as a college student. I didn't have kids. I didn't have, thankfully, given my circumstances, I didn't have to work a full-time job. I think it would have been substantially harder if I did.
Yeah.
And so what we're trying to do is recognize that a lot of our parent learners live in circumstances that force them to rob Peter to pay Paul when it comes to their time. They can either spend their time parenting their kids or spend their time working or spend their time going to school or spend their time studying. And it's very difficult to do all of those things. And so what we want to do is take some of the burden of work off of those parents, understanding the fact that every hour that those parents spend with their kids is an hour well spent, both in terms of what we all want to do naturally as people, but also in terms of the long-term well-being of those kids. Every dollar that we spend on that family, if it increases the probability that that parent finishes their educational path, increases the overall living conditions of that family. And that redounds to the benefit of the parent and the kids. So we see this as an opportunity to make a very strategic, targeted surgical intervention in a life that benefits both parents and kids.
I forget there's a city in California, it might be Oakland, that is experimenting with a basic,
So
and they've been
Yeah.
doing it for a year or two, and the early returns it's been very successful.
yeah, so Sacramento.
Just haven't been loading up at the liquor store or anything.
Yeah.
It's really having an impact on families. You've looked at that
Yeah,
program?
so this program is actually modeled after a program in Santa Fe, New Mexico, where they did exactly this. And the returns are really quite impressive. But there have been whole towns that have worked on this. Mayor Michael Tubbs happens to be a good friend. He initiated a program in, I believe it's Sacramento, where they did exactly this. And the findings are really quite impressive. You find that a lot of this money ends up getting spent directly either on some combination of childcare, food, or investments in kids. So like books at home, or toys. And we don't think of toys as being a really important educational investment, but I think about my 1-year-old, and the most learning she does is when she's playing around with a little toy with another person, right? And that's how kids learn. And so these are really, really important investments, and we feel like the early data is really promising.
And then lastly, there was a question that staff asked, does this mean we don't have the Wayne Entrepreneurs funded now?
We do. That's a separate program.
Okay, because the answer to that was, no, that the Wayne Entrepreneurs didn't fit whatever their criteria is, but that program is still going forward.
Yeah, so the
Okay.
initial version of this grant was meant to fund both programs.
I see.
Unfortunately, WKKF ruled, their lawyers
Yeah.
felt that it was, given their criteria, that just funding this program was safer on their side. That program remains fully funded, should not be a challenge in terms of executing on that program.
Sounds good. Thank you. Thank you, Madam Chair.
You're welcome. Commissioner McCormick, please.
Thank you, Madam Chair. So you know, I'm always asking about fairness and how do we roll this out and who gets what and how. So do you have a idea of how that is going to be rolled out?
Yeah, I mean, so first I just want to call in the criteria of who can access this program in the first place. We know that community college tends to be a more common option among lower income folks and among communities of color, right? So we're targeting that way in the first place. The second point, though, is we decidedly want to make sure that student parents from all of our communities, but in particular our communities where we know that student parents are least likely to make it all the way through community college, we want to make sure that our resources are going there. So what this funding will do will be used in part to target families to make sure that we are penetrating and we are marketing specifically to folks who could benefit most. We also intend to work directly with community colleges, and in terms of their participation, one of their requirements will be to share data with us so that we can think through who are the families that could benefit and how do we make sure that everyone's got a fair shot at getting access to this program.
Okay, and is there a estimated amount of families that you're looking at assisting? I mean, is it, 2,000? I mean,
So
how are you?
our initial program, I think it's about 500, and then we'll be collecting data for them and going from there.
Thank you.
Thank you. Commissioner Anderson?
Thank you, Madam Chair. The criteria again, would you go through that one more time?
Yep,
And
so-
where that originated from?
So parents under the age of 26 who are enrolled in community college. And that borrows directly from the Santa Fe program, where there's pretty good evidence that's emerged. And it identifies what we wanted to do was make sure that as we deployed these funds, we were deploying these funds to families who can make maximal benefit. And so we really wanted parents of young children, and we wanted folks who we could in effect buy out of one shift of work to be able to spend more time with their kids or spend more time on their education.
I think it's a very worthwhile program. I do have a concern about the equation or the equalness of this being spread among if it's someone that's not of color that happens to be in the same situation, why would they not be eligible also?
They would absolutely be eligible. Absolutely.
I thought you said of color only.
No, I think the concern is oftentimes for a number of structural reasons, families of color are just less likely to benefit from programs like this. And so our goal is to make sure that we bridge that gap, but the funding is open to everybody, right? It doesn't matter what your background is or what your circumstances are, the funding will be open for everybody.
I'm just hoping that you'll be casting a large net to include anyone they would not feel neglected or ignored the circumstances that they're in too.
Of course. And what I will tell you is obviously we know that unfortunately racial residential segregation is a thing. And we know that people are more likely to go to school in communities or go to community college in communities that they live in. And we know that we have campuses across the county. So, we've been working with college leaders at Schoolcraft and at WC3D, both here in Detroit as well as in Taylor, to make sure that we're offering this program everywhere. You know, our intention ideally is that we deploy this pilot, we look at the data, and if the data is promising, then we hope that we can work to a circumstance where this is a program that we offer to everybody, right? But you know, there will be no discrimination at the point of deployment, but we do want to make sure, given just history, that we're bridging the gap in knowledge of programs and access to programs that has tended to keep our communities of color from knowledge or access to programs like this.
Like I said, I think it's a great idea to try to do this and see how it works out. And I know Schoolcraft years ago, and I think Terry probably remembers it even better than I do. There was a women's fundraiser every year, and that was not based on anything other than their financial need to keep them. Maybe they would not be able to attend college. And they had, I think they had a big spaghetti dinner. I remember buying ads for the event, trying to help the fundraising effort. So I think those are, you know, I'd like to see all the community colleges do something like that to also put money into the pot, so to speak, so we are able to serve more. So anyway, thank you.
Thank you. Commissioner Colleen?
Yeah, I want to come back on once more here on the other questions. Do we have data on if you live in Wayne County and you're 26 and younger with kids in the house, what your finance, and overwhelmingly, these are going to be single family households too. Do we have data on what that, whatever you want to call it, cohort or whatever, what the economic situation is for families that fit that in Wayne County?
So we can borrow from national level data. And we know that, you know, single head of household families with a parent under the age of 26 tend to live below the federal poverty line. We also know that in circumstances where a parent has a child before they clear their teenage years, the probability that that person graduates high school, let alone graduates community college, is below 50%. So, you know, this has to be seen as one intervention in a broader set of interventions to empower families in these circumstances, right? This is not it's not a silver bullet, but it's one of many that I think we need to be thinking through.
And, you know, and I agree, and just in this job and living on the east side and having taught at Denby, the choices that these young mothers have to make, like sometimes not even having a job because they've got too much going on at home, and just basic things like getting the kids to school every day, you know, is there transportation in the house, and just don't have enough resources. And so I'm glad we're taking a shot at it. Thank you, Madam Chair.
Thank you. Commissioner Marecki?
Thank you, Madam Chair. So today this goes through, we're going to approve the grant agreement. Then we're going to see the vendor agreement, and then we're going to hear about the ARPA funds coming. So we'll be involved in each.
It would be the vendor agreement. The ARPA funds would need to move, but and that's what would need to come to commission. But the vendor agreement would be coming out of those ARPA funds. So that would have to come before commission and be approved. So once we've the RFP process has carried its way through, once we've identified who that vendor is, we would bring a contract to commission. Commission would have to approve that contract for us to move forward.
Wait, so the vendor, I thought this was paying for the vendor.
This will pay for some of the overhead costs of the vendor,
Okay.
but our overall contract will be us supporting the
With
vendor to support the program.
Okay.
Yeah.
Okay. All right. So we will see that then.
Yes.
And so is the ARPA funds coming from the funds your department got? What was that, 30 million?
Yes,
It's
that's right.
coming out of that.
Yes.
Okay. Thank you, Madam Chair.
Okay, thank you. Any other questions? Hearing none, thank you, Dr. Syed. Yes.
Madam Chair, I'll move approval of item, I believe it's 3
Mm-hmm.
on the addenda. I'll move approval of that item.
We need a motion for item 1 as well, which is a receive and file.
Yeah, I was gonna get to that.
I'm sorry.
Yeah,
Oh, we didn't do item one?
no. And if it's okay, Madam
he
Chair, I would
had-
include for item 1, a
Okay.
receive and file as part of the.
Right, yes, thank you. All right, is there support? Hmm. Okay. Oh,
No.
Commissioner Marecki supports?
Commissioner Beckman McCormick?
Oh, okay. I'm really having problems seeing it. Okay. Okay, Commissioner McCormick supports. All in favor?
Please vote on your tablets.
Oh, okay. Use your tablets. All right, thank you.
Motion
is-
carried.
Yes, and I support. My thing is down. All right. So. Motion is completed. Next item, please.
Item 2. Discussion on the Wayne County Regional Educational Service Agency and Care Management Organization reports.
Oh, we're going to, oh, they are here.
Come on in, the water's fine.
Okay, I thought that was different. Okay. All right.
Good morning, Madam Chair.
All
Melissa
right.
Fernandez, Director of Juvenile and Youth Services.
Hi, good afternoon. Tia Loran, Deputy Director of Juvenile and Youth Services.
Okay.
So as far as RISA, Dr. Colbert and team could not be here today, but they will be here next week to discuss. I think that's what you said. they
Oh,
were here.
okay.
But we did want to speak towards the CMO report. Commissioner Baker McCormick last meeting expressed wanting some more information on how we adhere to our guidelines with CMOs. Okay, so all CMOs, our contract team, we do conduct on-site audits in person every month, and we also conduct virtual audits. And so all of our requirements are in line with childcare funding and reimbursement requirements for out-of-home care and in-home care. Now, that being said, a lot of the CMOs have ancillary services that they do based on their own grants and based on their own services. And so while we audit the CMOs and we expect the same outcomes across the board, some CMOs do have more opportunity and have additional programming. And so based on that, there are some issues with equity across the board. Although we do audit and we have the same expectations, again, some CMOs have the resources to be able to receive grants and additional items. We are currently working on our CMO extensions and looking at, how do we put in place additional items so that we can see better equity across all of the zip codes. And I know that was one of the concerns that you raised, and you're absolutely right.
So,
Go ahead.
thank you. So in particular, at Insight, which is in my district, I know that they're there, but I don't really know that they're there. You know what I mean? So I was just curious as to, how to make the program, I guess, better, for a lack of a better.
Sure. And again, we are on the same page there. So Insight did have a leadership change last week, and their CEO, Michelle Rauser has retired after many, many years. And so the board is in the process of seeking a new CEO, and we do have a meeting with them in August to have that very discussion. What can we do to support you and to help you apply for some of these grants or be able to offer a variety of services that some of the CMOs don't.
So do we, when does that go out for bid?
That's 2025. I believe there are two more
Okay.
extensions on that. The
Okay.
next extension is coming up here in September.
Okay, so then you'll look at from now until September, what's the best move?
Correct.
For that?
And we will absolutely keep everyone updated on that.
Okay.
Any other
Okay.
questions? Commissioner Tlaleen?
Yeah, just for clarity in the discussion we've had today and before. We're looking at perhaps doing some alignment in the CMO contracts
Correct.
to provide for similarities so we don't run into this. So that's one thing we'll be looking at, especially for the new RFP when that goes out. Is
Yes,
that the goal?
that is correct.
Okay. Thank you. Thank you, Madam Chair.
Commissioner Marecki?
Thank you, Madam Chair. Do any of the CMOs do fundraisers?
They do.
They do.
Oh, yeah.
They
'Cause I'm
absolutely
trying to
do.
think if our CMO, if GrowthWorks does.
They do.
They
They
do.
do quite often. I can include you in some of those emails.
I can't even, yeah, I don't even remember going to one, or I'm surprised we don't get, you do?
Yeah.
Okay,
Yeah, they
maybe I'm
all-
just having a brain fart here.
No.
Okay.
They all have big fundraisers.
Mhm.
Get on the Ovation or something
Yes.
like
So,
that.
That was a few weeks ago.
Yeah, right.
well, that's not a fundraiser.
No, it wasn't a
That's not a
fundraiser. It was a
fundraiser.
friend-raiser.
It's a fundraiser, not a fundraiser. So are there some CMOs that don't do any fundraising?
I think they all do, but I think they all do at a different, capacity.
Some know how to do it a little better
Correct.
than others
That is correct.
do. Yeah.
And I think that's part of the challenge in what some CMOs offer is some of them do a better job of the fundraising and friend raising and have the opportunity to provide stronger programs. But
Yeah,
it-
because the staff might be very in tune with that, like Chamber of Commerce's
Yes.
and that kind of thing. So,
Exactly.
All right, thank you.
Any other questions? Hearing none, thank you so much for
You're
being
welcome.
here to discuss this. Next item,
F, such other matters as may be properly submitted before the committee.
I have none. Next item,
G, public comments.
is there anyone on the Zoom wishing to make a comment? Or anyone on the phone wishing to make a comment? Hearing none, is there anyone in the audience that would like to make a statement? Anyone in the audience? Hearing none, thank you so much. Next item,
Adjournment.
thank you,
Yeah.
Commissioner.